Prevention better than cure. Let's see what it means when we talk to Dr. Ambika Nair, co-founder and chief consultant of Santhigram Group of Companies, a proper program for you where we give you awareness and, of course, information how to prevent certain conditions of this body that comes with age, time, and lifestyle. Let's welcome Dr. Ambika Nair. Namaskaram, Dr. Nair.
Namaskaram.
Dr. Nair, feast and food go together, and of course, this body loves food. Now, after eating food, some of us feel lots of pain in our chest or behind the breastbone. Some call it heartburn. Let's first understand what are the symptoms, and then we'll go towards prevention.
Yeah, that's a very good topic you're giving me today. Good.
Food, no, Dr. Nair, we cannot live without it.
Yeah, some people, that is actually due to indigestion and even with anxiety. This is called hyperacidity also. Instead of, the ruge, brings it down, like with the gravity. Here, what will happen? Everything goes up, upward movement. So, in between the ribs also, people will, complain of so much of burning sensation and food is stuck over there. Somebody will tell, oh, as if like one boiled egg is kept in between, like on the esophageal area, it's very difficult also. So that's, so many cases like this, they go to the ER, like with the panic attacks. It's a very big, because they can't even breathe.
So this sometimes may be misdiagnosed and people assume it's like more like a heart pain, right?
Yeah, heart pain, and heart issues, they will always tell like that. Okay. And it can be, like a dyspepsia. It doesn't come, just like that. So sometimes, it will be there for a long time, and if you cannot manage it, everybody will have a little bit of distended abdomen sometimes, like a bloated thing, like vomiting or something, and after eating certain foods. But here, if we cannot manage it for like continuously coming for a long time, then you have to see a doctor.
Okay. Now, can we also understand that this can happen suddenly to anybody, or somebody also is a chronic patient of heartburn?
No, sometimes, some people will have ulcer in the stomach, even GERD will be there.
Okay.
Gastritis, stomach cancer can be that cause, any infection like H. pylori, all those things, IBS, irritating bowel syndrome, okay, stomach cancer, even thyroid cases, and even pancreatitis. There are so many reasons can be. Even sometimes, there is improper emptying in the stomach that they don't evacuate. It is not a complete constipation, but they will not evacuate it properly. Even gallstones, cholelithiasis, severe constipation, even pancreatitis, like a pain in the stomach. There can be, like any like a blockage in the intestine, even intestine and any ischemia. Some areas it does not have any circulation. So that everything can, cause all those things actually.
Now, what about belching, burping, and sometimes
that is little dyspepsia actually, because they will be just, that is actually with the, like a GERD, that is with anxiety also.
It comes with it also.
Yeah.
Okay. And what about sweating? I mean, do people usually sweat a lot?
That is, that's what I told you, people will come and tell me, like, oh my God, that I was heart burning and I was sweating and I went to the ER.
Okay.
So that is, but it's not a must that some people will get it, some will not.
And is it life-threatening?
If you don't take care, underlying, if you don't have anything like that, then it's okay. Otherwise, you have to diagnose it and treat for the root cause actually.
Okay. So now, friends, you have heard what are the symptoms of heartburn, and I'm sure most of us have experienced one or two symptoms of that after having a good meal or a good feast. So let's talk to Dr. Nair and understand how to prevent this. I mean, whether it's on a one-off basis or on a chronic basis, there must definitely be something which can prevent this in our daily habits or food habits. Dr. Nair, what is the prevention for heartburn?
Yeah, because actually we have to have a self-awareness. Our program itself is awareness only. Okay. So, don't chew the food by, keeping the mouth open. Okay. Another thing, while talking, like you're distracting, but when you are, eating, you indulge in that only. Focus on what you're eating. It should be a conscious eating. That's more important actually. Don't eat too fast in a hurry. That is also not good. Avoid foods which trigger indigestion, like heavy meals. Okay. even very large meals, even though you are not hungry, sometimes, we indulge in eating such things, So you can have like a small meals, like a 5 to 6 meals, like instead of like a 2 or 3, like a very large meals. At time management, proper time has to be managed. And the same time, every time, try to do that. Actually, it will help a lot. Okay. Avoid food at all times, see, people are working in different time zones, so that is also, but they can stabilize one time, like eating at midnight unnecessarily, like eating unwholesome food, which you, like it will always react. And every time when you eat, like there's some allergic foods and all, it doesn't digest. That's why in Ayurveda, we always say, like, because if you are acne, general acne is good, you can eat everything if the digestion is good. But all the diseases are always connected with your stomach. 90% of the things. If your stomach is good, you get very seldom diseases. Relax after taking food. That is not possible in this country, but still, like 5 minutes, you can always. And, like, if we can, like avoid very sour food, like, and very spicy. It's all, like it's a must for everybody. And,
so
like
fermented food sometimes also. Right?
Fermented means over fermented, like idli, all those things, it will be okay. But, if it also causes certain, like indigestion, then avoid that actually.
Okay.
And, like too much of aspirin, brufen, all those things, painkillers also, because actually it will also cause acidity. So, like it, try to minimize whatever you can. Okay. And take beverages after meals, that is also, like not during the meals. After the meals, we can take all those things. Even drinking water, that has to be taken care actually.
Doctor, when we spoke about fermented food, or when we spoke about food that is a shelter for longer time, and of course, most of the things, suggestions that you've given, as easy as it sounds, is also difficult because our lifestyles are that. But as you always suggest, health comes first, so you have to make these small changes. Now, we have seen this trend of, food being cooked and freezed or frozen, and then, warmed up again and again, eaten every week. People cook meals for a week or 10 days. In that cases also, do you see that this can cause heartburn?
See, that instead of like overheating and everything, small quantities can be kept.
Okay.
Okay, so that will help a lot, like avoid caffeine. So many people, they take a lot of caffeine, processed food, like carbonated, like, but, like, see, if it is working, there is no issue. But if it is not working, like excessive oil use. Okay, so, sometimes, like even citrus fruit, which are acidic also will not work, like even tomatoes, eggplant. That, when they come, we have to see the constitution, and accordingly, we will tell them the diet, what they are supposed to use.
Wow, okay.
And so, in this condition, we will always tell them to use only cooked food.
Yes.
Yeah.
So Dr. Nair was just suggesting certain lifestyle changes when it comes to heartburn, whether it's chewing slowly, closing your mouth and eating, and of course the kind of foods. Now let's get into more details about foods that can calm this or help to prevent it. You just mentioned about tomatoes and citrus foods. What about some vegetables which should be avoided, or fruits that can be avoided, specifically when you mentioned citrus?
Yeah, spice actually.
Spice, okay.
Yeah, spice is more important actually, especially chilies, red chilies, we don't allow the, see, it can be because of a gastric ulcer. So your diet has to be according to that.
Okay.
Yeah. You can practice meditation, yoga. If you are, like alcoholic, quit it. If you are a smoker, you can always come out from that. Like, see, you have to practice, amendment is there. Amendment has to be there. That's why, little bit of, like a self-discipline. So much, some people indulge in
sorry?
Some people, they indulge in playing games a lot. Oh. And, like just, like, no exercise, avoid doing exercises, even after eating, this all little bit, like a sleep is also more important in these things. Don't sleep immediately after food. That's why we always tell, in India or in our places, in Asian countries, after eating, just don't get into the bed. Okay, leave little time. Okay, so otherwise, sleeping
lifestyle
position.
definitely is creating a bigger problem here, because heartburn is definitely related to that. So Dr. Nair, when you're mentioning about prevention, we're talking about certain foods that can be avoided. Now, once again, viewers, when you're taking these home remedies or suggestions, it is please to be remembered that this is body specific. Not every remedy applies to every body type. So once you get a consultation about what your body type is, these home remedies can be just done from the comfort of your home. So Dr. Nair, when you're talking about foods that can be avoided, what are the foods that can calm once you get heartburn? Many of us think if we drink lassi or buttermilk, it calms.
Yeah. Buttermilk is always good, like that is like little like what you call sweet things. Sweet things will work in this actually, because it is like antacids, it will work. And like you always, like you should have a regular exercise. Your sleep should be very good. And while sleeping, sleep in a position where your head and your chest are higher than your feet actually. Okay, that will always help in this acidities actually. It helps a lot actually. Burping,
so I was just asking about what are the foods that can temporarily help you to relieve heartburn? Like
rice
cold
is
milk?
very good. Little cold, not very warm. We always tell them, room temperature they should take it. It's not be very cold or very hot. Avoid that. Actually, only cooked food. Raw things we don't give them, especially in IBS and when they come, we tell them to take a banana. Okay, so this all like, because according to the case we have to treat them actually.
Okay, can heartburn also come if I have skipped meals?
Definitely. Time management. Yeah. Sometimes in these cases they will have like so much of fatigue because of burning sensation. They will not eat actually. They will have like see, if you look at their tongue itself, we see that the tongue diagnosis is more like uncomfortable feeling in the abdomen. Even after eating the food, trouble in swallowing food, which get progressively worse. Fatigue will be there, so tired they will lose weight. Unexpected actually, and loss of anorexia, loss of appetite is also seen in this. So we have to see and diagnose them properly. So many cases comes to us, even panic, like shortness of breath, severe sweating will be there, even chest pain, everything, it is over here. You can't explain. They'll come and tell you don't know, doctor, what's happening with us here. Yeah.
Yes, sir. So in the series Prevention Better Than Cure in Aware and Care, we've been talking about symptoms and conditions which can be prevented before it goes to a worst case scenario. Of course, if you are facing a certain situation and a health condition, Dr. Ambika Nair and her entire team is available for consultation in the tri-state and also online across the globe. Thank you, Dr. Nair. Today's episode on how to prevent heartburn. We look forward to more such episodes where we can, hold the problem before it explodes. Thank you for today's episode.
Thank you so much.